TopMedTalk.
All right, well, welcome back to TopMedTalk. We are live from San Diego for Anesthesiology 2021, the American Society of Anesthesiologists annual meeting. I'm Desiree Chappell, host today, and joining me is my colleague, Professor Sol Aronson. Hello, Sol.
Hi, Desiree. How wonderful has it been to be here live in San Diego?
I know.
And this is day two.
End of day two.
End of day two, last session.
I know. Well, we saved the best for last,
yes,
Sol.
Yes,
We've been having fantastic conversations in the exhibit hall over the last 2 days. If you've missed any of those, please be sure to check it out in the on-demand content at live.edpom.org. Also, it'll be on our podcast channel, TopMedTalk. We'll tell you a lot more about that a little bit later on. But without further ado, I want to introduce our guests today.
Let's get right
We have
at it.
President of the ASA, Dr. Beverly Philip, here to join us.
Absolutely.
Beverly, thank you so much for joining us.
My pleasure entirely.
It's wonderful. I know that your schedule must be so hectic, but just to take a little bit of time to sit down with us is fantastic.
Well, it's important. It's really important to communicate to people about what ASA is doing, and we're really glad to be here with you.
Absolutely. We also have President-elect Dr. Randall Clark. Thank you so much for joining us.
Thank you, and thank you for having a in-person presentation, first big one in about 18, 19 months.
Yeah.
And thank you for having us have the opportunity to do this.
I mean, we're going to talk about challenges of the year, and the other one is having the foresight and the determination that this would be a success in person, and it certainly is.
And isn't it nice just to see people in real life?
Yes, it is. Lovely to see.
Yeah, we've been been at this meeting in the years past, and there's always a lot of buzz and excitement in the exhibit hall and throughout the halls in the presentations. But this year, I think there's especially a little bit of I don't know what it is, effervescent quality to the whole thing.
One of our guests
really
earlier characterized the term a burnout anecdote.
Yeah, because we're all kind of feeling a little bit.
Oh, I think I don't see it as an anti-anything. People love being with people.
Yeah.
And we love our colleagues, we love the work that we do, and this is how we do it.
And I think by the nature of our work, anesthesiologists are very much social creatures, especially in the operating room and with our colleagues. It's nice to be back together.
Yeah, absolutely.
So, congratulations, ASA, for making this happen.
Yeah.
Thank you.
Absolutely. Well, let's go ahead and kind of get right into it. Beverly, I want to start with you and just let's talk about this last year in your presidency. You know, it's been filled with struggle. We all know that with COVID and everything like that. But let's start with the positive aspects of this last year.
Well, I've never seen it as struggle. For me, their obstacles are an opportunity to get around them, get over them, find a way towards a positive future. And this year has been really no different that way at all. I think the challenges actually have remained the same with the 2021 version, but the same. And our challenge has always been, as an organization, is to find our own future, to ignore the chatter of the universe, and that we decide who we want to be as a specialty. That has not changed.
Yeah, no, I mean, I think that's very true. What are some of the things that you've been most proud of this last year?
Well, I went into organizational leadership because I really like helping other people reach their goals. And this is this is the big accomplishment that ASA's leadership can do. All the members with all their breadth of interests, we as leaders can give them the opportunity to succeed at what they do. And you look at the membership of ASA, it's all these interests, whether it's academic, whether it's science, whether you have a subspecialty interest, whether you like history. We as leaders can enable everybody's best vision of the future for this specialty.
Yeah, that's great. Well, I want to ask both of you, as we look forward in just anesthesiology in general, what do you see as the future? It's a big, broad, open question.
No, but it's really very important. And I don't tend to look at the. I like the longer view because that will give us focus on what path to take to get there. And then what happens this next year is a path towards that. So I think the future of our specialty, as I see it, has three strong points. I think the biggest and best of them is a future in healthcare leadership. So whether it's leadership of your department, leadership of your healthcare institution, leadership take on government too. They could use some more physician anesthesiologists there. So I think looking to how we can create a future where we can be the leaders in healthcare, where we belong, where we have the aptitude and the ability, that's it. So feeding into that, other things, we have a real aptitude for technology. And this is what we do. We all like devices, so we want to look at the future of technology, and with that tying into really future of being leaders in innovation, whether it's innovation in technology, whether it's innovation in research, whether it's innovation in healthcare. We are really good as a group, as anesthesiologists, at problem solving. So looking to where we want to fill out the details of those, that's where you fill in the short term.
Fantastic.
If I could add to that.
Please.
Yes.
So first of all, I want to say what an inspirational leader Dr. Philip has been this past year. It's just been an absolute pleasure to work with her. I think the future is bright, as I said this morning, and it's bright because anesthesiologists are such an essential component to most parts of a hospital. We think about operating room anesthesia, but it's much more than that. And our mission and the reason for ASA and the reason for a lot of the people you see around you here is driving the improvements in the care we provide to our patients. Dr. Aronson is highly skilled, highly accomplished in that regard, and can probably speak volumes on this very subject.
I blush.
Beverly mentioned the innovation and the new systems of care, and Dr. Aronson has been part of that. But ASA is part of that as well, and those are the areas that we're putting our emphasis and in putting our investments for the future.
Yeah. And if you take it in the bringing it down to that shorter term, so where are we going to, what is like in the next step into our future? And I really think that is in perioperative medicine.
So thank you. You just sort of touched on. I think anesthesiology is an adaptive specialty, and
yes.
over the years, the theme that you raised, Beverly, I think is consistent and constant. Yeah. But the if you will, target has been a bit fluid, and anesthesiology as an adaptive specialty has addressed that. And so where is that, if you will, primacy of target today? And you touched on it before I could even ask my question.
Great minds think alike.
Yeah, that's right.
Yeah, that's great.
But that's the short term, I think the nearest short term application of where we want our future to go. And the operating room, we are the physicians of the operating room, but we are the perioperative physicians. There is no other physicians that have the knowledge, the expertise in knowing how to make a patient have the safest possible anesthesia, and you have to do that in advance.
Yeah,
and I think even having with the COVID that is around us, this has even amplified that to a very large degree, because now people are having new chronic illness that they have come into with this disease, and it is on us to make sure that patients are at their best.
And though it seems perverse to even have this discussion, because I agree it's obvious and should permeate any time or place, but with the external tension and pressure from the evolution of economics of healthcare, it's even more pressing.
It is even more pressing. Yeah. And I think the other theme that always, the technology theme that resonates to me, particularly resonates in the post-op part of our perioperative medicine. I'm an ambulatory specialist. I've long believed in the increased value of patients getting out of the hospital as soon as possible. Everybody benefits by that. So as our technology is allowing us to do more and more complicated procedures, patients are going home after operations that no one even dreamed of. You go back 5 years, it was a 5-day stay for these things. How do we make it safe for the patient at home? Implementing telehealth at home, innovation in technology so we can monitor our patients at home.
Yeah, absolutely.
How is the ASA, this is a what do you think to whomever and both, is enabling the adaptation of those tools and technologies so that we can more easily expand the breadth of our specialty to those touch points beyond the hospital?
So it's going to be a process, and as you well know, we've been working on this for a very long time. You and your colleagues in North Carolina have done a great deal of work in this space. We really began seriously discussing transforming the specialty into this broader arena 5, 6, 7 years ago. it's going to take a process and it's going to take time. We have to change many parts of our system. We have to change the training programs. We have to change attitudes. And we have to change the receptiveness of others in other specialties to the types of services that we're talking about in perioperative medicine. All of that's going to take time, but I think it's absolutely essential. And ASA hopes to be one of the partners. We need multiple other partners with academic chairs, hospital leadership, other medical specialists to be able to accomplish this. But I'm very confident and optimistic that we can do that.
Yeah. So what I did this year is I started a committee on perioperative medicine to give some, as we've been saying, discussing among ourselves, putting some meat on this proposition, and that to look at what do we need. We need education in the area. What would a fellowship in perioperative medicine look like? What data do we need to collect? How are we going to make this real? And I think we are. I think that the pandemic has given us the nudge to really get going on this in a way that that has been, I think, hugely valuable. And the other part, because you talk about collaborating with other societies, that's been another amazing side benefit to this pandemic. People, because of the real PR push that our specialty has had, being leaders in solving and addressing problems. So now we're talking with other medical specialties in ways that just did not happen.
Yeah, one of those silver linings.
Sorry, do you think the COVID crisis, if there's anything good to come of it, and that's a conversation that could take weeks, do you think that we as a specialty were elevated in terms of our visibility of standing up?
Absolutely.
When the bell rang, we got up first. And do you think that has a legacy of memory that will last long after COVID, God willing, goes away?
I'll let Randy talk, but the one thing that really strikes me every time is our residency match rate this year. We filled 99.8% of positions available. We outpercented any other medical specialty altogether, top of the charts. And this is the vote of confidence from the physicians of the future. So, yes, I do think so.
And to your question about the visibility of the specialty during the pandemic, it's been absolutely amazing to have anesthesiologists recognized from the White House, from the COVID group at the White House by the Vice President, recognizing the contributions of Mary Dale Peterson, the immediate past president, is truly extraordinary. At that time, it's important to note, we were looking at the potential. We didn't know for sure, but we were looking at the potential for ICUs to be overwhelmed in several parts of the country. We were running out of ventilators, and there were some strategies being discussed that were potentially quite dangerous for all patients that would be involved with those. And the ASA brought forward our ability to help in both critical care medicine and through ventilation with 70 to 80,000 anesthesia ventilators that we have in operating rooms and procedural areas across the country. That provided a huge sigh of relief, and it really identified anesthesiologists as the problem solvers that we are, but also as the ability to address a bunch of different types of care, because that's what we have to do when we take care of patients in the operating room.
Definitely, yeah. That's what I had said earlier. I think it gave a podium and elevated the specialty, so much in a way that had never been before.
And to come out behind the mask and have people say, I get it.
Yeah.
There's one other side effect that we've seen is that, as you know, critical care medicine in the U.S., anesthesiology is one of the specialties that contributes to that. And I think quite appropriately, we've seen a rekindling of interest of that as a career field among our residents. And that is only a good thing. Yeah,
absolutely. Well, switching gears just a little bit, the annual meeting, this is where it happens, right? This is such a great week. What are some of the highlights for you this year, Beverly?
Oh, I mean, numbers 1 through 10 is being with friends again. I mean, that's right off the top.
Yeah, of course.
No, because and not only in just a personal fun sense, but if we're trying to make progress on pretty much anything, you've had your share of Zoom meetings. You've all had more than our share of Zoom meetings.
Got to be in the room, don't you?
You do. The Zoom meetings work in terms of developing ideas only based on when I'm working with people because I know them already.
Yeah.
That I know what Sol's going to say. Or, I know the body language that goes with it, and I can sort of color in the rest of the shadings. And as time goes on, and appropriately, new people join the circle, they don't have that fill-in information, and we don't have it for them either. So this real need to rejuvenate the working group in terms of getting things done. Everybody's talking that they're meeting committee meetings, all the work is getting done, and aside from just the personal exuberance, it's really people do better working with other people.
Yeah, absolutely.
Absolutely no question. Whether it is addressing current challenges or just strategizing about the future, the ability to have a personal conversation with someone up close makes all the difference. And since arriving in San Diego last Thursday, it's just been continuous conversation in that regard. And it's really been, I've developed a list of things to do. As long as
it's like, oh my gosh, I can't forget to do this whenever I get back. I got to call this person. And this
is email me.
And nobody said you're on mute.
Right. Exactly.
Yeah, absolutely. Or the Zoom bomb.
The phrase of 2020.
Right.
Yeah, exactly. hey, you're on mute. The future of anesthesiology, is our younger generation and the medical students and residents. Yeah. What are some of the things that you would tell them right now at this point in anesthesiology, Beverly?
Well, when I talk to people interested in why should you be interested in anesthesiology, and I think it's just there are really two strong threads come together. What I loved about anesthesiology from the beginning is the intellectual challenge of it, that you need to have enough physiology, pharmacology, all this knowledge that you get to implement right here, right now, in a scientific sense. That's how I build my anesthetics. I'm pharmacokinetics kind of is my sort of fun entertainment, and I do mostly my own cases. And so I'm trying to craft scientifically an anesthetic. So it's a great intellectual challenge every day, all the time, every patient. And then, of course, there's the fact that you get to do things. So it's not just sitting around and going on rounds and just talking. You actually get to get it done now. So there's a really wonderful combination of real intellectual ongoing challenge and the fun of actually doing things physically.
Yeah.
Couldn't agree more. We're both in training programs. I tell the medical students that we see and the residents that have chosen anesthesiology, it's the best specialty in medicine for all the reasons we've talked about already. But every day you go in, the intellectual challenge of what you're approaching is what really keeps us going. And I can't imagine too many other specialties that would have the equivalent of what we're able to do.
Yeah. Don't you think what I've found is that when you go to you listen to a conversation, so what do you like about anesthesiology? And I would say the answer that you hear people say 99% of the time, it's fun.
Mm-hmm.
And that is, I don't know any other specialty who, when you ask people why they're doing it, because it's fun. And I know that certainly was something that attracted me very early on also. These people first of all the talent and knowledge that you can accumulate, but people are doing it for the joy of it. That's really special.
I'm just listening to your answers, and I love that answer, and it actually forces me to go back and live and take account of why I went into it, and thank you for sort of triggering those memories, because we've been inundated with these external distractors and the world and all the other things that we kind of focus on, but at its core, it is because I love physiology, I love pharmacology, I love the immediacy of a response.
The scientific evolution of the patient's there.
And it's actually really important for us, I would submit, to push refresh on those core values and reasons, because I think we've lost that probably in the shuffle of all the other messy things that have been going on.
But that's why we have interviews such as this, just helping us
That's
get
right.
that message
That is
out.
right.
Yeah,
Well,
yeah.
I mean, I guess
Absolutely.
further to that point, as we go forward, and Beverly, as you round out, your term, and Randy, as we go forward, what is the refresh button, do you think?
It really depends on the individual. Some are happy to dive into more and more detail on their particular area of anesthesiology and just become true masters. And it's advantageous to be able to do that. We usually teach in our training programs that it's advantageous for you in your career to be truly a master of one specific area. But if you change your mind, you're able to change your mind, and you can move into other areas, whether you go from operating room anesthesia to outpatient anesthesia or any of the subspecialties, moving between pediatric, cardiac, OB. They're all substantially different and all have their own unique, interesting challenges. Back to the question of what's so attractive about the specialty, I just wanted to add, like anything worth doing in life, it's multidimensional. Mm-hmm. It's certainly fun, but there's also, I think, the satisfaction of taking the responsibility for those patients. Now, most physicians do that, certainly surgeons and others take that on as a core part of what they're doing. But you in the operating room are really the one there to protect the patient. And at the end of a tough day, when everything comes through just fine, that's hugely gratifying.
Yeah,
Absolutely.
I think, and that's so. I have a senior elective in negotiation in my department, and it is just when they talk about the conflicts in the operating. Why are the surgeons so nervous about things? Because they know in their hearts we're keeping their patients alive, and it is a great responsibility.
Yeah.
It is, and that's worth doing.
Absolutely.
Worth doing.
And I'm going to invite, in addition to those core things that we just talked about that are, at the foundational essence, there's also an heightened recognition of the connection between anesthesiologists, especially in population health, to really sort of expand the breadth of that. Many people don't touch healthcare until they have a declaration of need for surgery. And I think our responsibilities, I'm going to ask you to comment on this, to ensure that they're brought in safely and then transitioned out safely to healthcare providers is a burden that has been unmet heretofore that I think we need to own.
Yeah.
Please join us at
Announcements. Hold on one second.
Live radio.
Live shows.
I wish for you to comment on that.
Be happy to.
Yes.
I think we're good.
We're good. Dan Cole, former ASA president, I describe him as a quiet genius, saw the need for anesthesiology to investigate population health. Most of us thinking about the topic really think of it from an aspect of primary care and systems of care outside of hospitals. But there's so much work, so much critical work done in hospitals, it has to be incorporated to be part of the pie for population health to be successful. So, as you well know, we put substantial resources into working on identifying how anesthesiology can be more involved in population health. It really comes down to the partnerships you're able to forge with your healthcare system. If the healthcare system embraces the concept and they're ready to move forward, I think we've seen examples that are relatively successful, as you well know. If those systems are not quite there yet, there's not much progress being made. But when we look at some of the challenges related to payment and other issues, taking a global approach, including a population health type approach, will be absolutely essential for us to get a handle on expenses and continuing to drive improvements of care.
That's great. Beverly, do you have any comments on that?
Well, I take it from, again, my career perspective, but that everybody deserves an ambulatory anesthetic. That this is an approach that actually we are building out from what we are doing now in terms of looking at the patient length of care and bringing patients into anesthesiologists who are among the founders of the Freestanding Surgery Center system, that they had a vision that this was a better way to provide health. And they went to the insurance companies and fought for payment. Said, we can show you, outcome-based, evidence-based, we will show you this is better for patients. So we need to continue on these trajectories that we are doing, continuing to build it out longitudinally and laterally, and can only do that with all the other healthcare professionals involved. It is team-based care, and again, the first surgery centers were founded by 2 anesthesiologists, but they got the surgeons engaged with them as partnerships, and the nurses, and the administrators.
Just to build on that, I think the future, if we're going to be really successful, is going to demand that we build up very effective, very well thought out systems of care. We have to be able to do that at the same time that we maintain the individual excellence of some of our hospitals with their high-end care. But when we look at rural populations and underserved populations, it's really going to only be cooperation through systems of care that address those needs. It's a completely unmet need right now, so there's a lot of upside in that particular area.
Yeah, absolutely. Well, I want to thank both of you so much for joining us. Congratulations on your this past year.
Wonderful year.
Yeah, as you are handing over the torch, what's next for you?
Well, first of all, I'm not done yet. What the immediate past president does is sort of work to mentor the people coming into the system. I think one of the things that I've enjoyed, I do like sort of setting up processes, is I think that we have been working together developing a longitudinal partnership in leadership. That instead of being, it's this is Beverly's year and the next is Randy's year, that we have been working together this year and with Mike Chappell coming in to have a continuum of leadership. We have different interests, different thrusts, but it's all in the same framework. And what I can do as a leader is to have Randy start at a run already and not have to spend the time come up. This is terrific. So I think it's the immediate past president is sort of a mentoring role, which I just love, and so there's plenty of work to do.
Yeah, absolutely. And Randy, congratulations to you.
Thank you.
And good luck in this upcoming year.
Thank
and
you.
Number one thing that you're gonna really promote this next year.
I just want to build a little bit on what Beverly just said. We have a very effective and talented executive committee. It's the 4 senior officers in the organization. You know that sometimes there has to be one decision maker, and that's the president. But much of the rest of the time, we work in a very collaborative manner and do shared decision making across the really significant problems. The number one issue that I want to continue to promote and that we've already done great work on in the last 10 years is proving the value of the anesthesiologist to their patients. And that's going to help us in most of the realms where we currently have challenges, but we have to deliver on that proposition. And so that's where we've already given considerable focus, but it'll continue to be a priority of the organization and me.
All right. Well done to both of you. Congratulations. Good luck on all your future endeavors. And again, I know you're very busy schedule, so thank you for taking the time.
Thank you for having us.
Thank you.
This is so much fun.
And I just want to say thank you.
Yes.
And I look so much forward.
Thank you.
Absolutely.
What a pleasure.
Yeah, thank you. And thank you for listening and watching TopMedTalk. Again, you can find all the on-demand content, everything we recorded here at the meeting this weekend, as well as things that we've done over the last year at the live.edpom.org site on the on-demand content and at topmedtalk.com. Thanks so much for listening. Cheers.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EdPom, evidence-based perioperative medicine. We'd love you to find out more about that. If you check out edpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out edpom.org now.